Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Let us begin with a command. Do not treat every headache as if it has the same engine. Ask the first question. Why does the head hurt? Is it a tight, band-like pressure after stress? Is it a throbbing one-sided attack with nausea, light sensitivity, sound sensitivity, or visual aura? Is it sudden and explosive, the worst headache of someone's life? That last one is not a supplement conversation. That is an urgent medical conversation. Seek emergency care for sudden severe headache with fever, confusion, weakness, stiff neck, vision changes, or a new dangerous pattern. Start there. Protect the person first. Now, once danger signs are not present, ask the more useful question. How can a mineral help a headache? Magnesium does not work like a standard painkiller. It is not simply turning off pain. Think deeper. Magnesium is involved in nerve signaling, muscle function, blood pressure regulation, energy production, and the movement of calcium and potassium across cell membranes. The National Institutes of Health describes magnesium as a cofactor in more than 300 enzyme systems, including pathways tied to nerve impulse conduction and muscle contraction. So, when we talk about magnesium and headache, especially migraine, we are not talking about a random wellness trend. We are talking about a mineral that sits inside the electrical language of the nervous system. Here is the key idea for today. Magnesium may help certain headaches because it can make the nervous system less trigger happy. Why does that matter? Because migraine, the headache type with the strongest magnesium evidence, is not only pain, it is a brain state disorder. The brain becomes easier to excite, easier to disturb, easier to push into an attack. So do this. Stop asking only, what can I take when the pain starts? Also ask, how do I make the brain less likely to start the attack in the first place? Let us go inside the brain for a moment. Ask, why would low magnesium make migraine more likely? One answer involves glutamate, one of the brain's major excitatory neurotransmitters. Glutamate is necessary, but too much excitatory activity can make neurons behave like a room full of smoke alarms, too sensitive, too reactive, too ready to fire. Magnesium normally helps regulate NMDA receptors, which are deeply involved in excitatory signaling. Reviews of migraine biology describe magnesium as a modulator of neuronal excitability, neurotransmission, and cortical excitability, partly through NMDA receptor regulation. Now ask, how does that connect to aura, light sensitivity, and throbbing pain? Migraine with aura is associated with cortical spreading depression, a slow wave of intense neuronal and glial activity followed by suppression across the cortex. This wave is not imaginary. It is a known neurophysiological phenomenon. Magnesium metabolism appears relevant because NMDA receptor activity and glutamate release help shape this process. If magnesium is insufficient in the wrong tissues at the wrong time, the threshold for this wave may drop. The brain becomes easier to tip over. But listen carefully. Do not oversimplify this. Do not say, all headaches mean magnesium deficiency. That is not true. Instead, say this. Magnesium is most evidence supported in migraine prevention, particularly in people with frequent migraine, migraine with aura, and menstrually related migraine. The American Headache Society and the American Academy of Neurology classified magnesium as probably effective for migraine prevention, meaning it should be considered for people who need preventive therapy. Why is that clinically interesting? Because many preventive migraine medications work, but some people cannot tolerate them, cannot access them, are pregnant or planning pregnancy, or simply need a lower barrier first step under medical guidance. Magnesium oxide tablets are inexpensive, do not require a prescription in many settings, and are often discussed as a prevention option because serious side effects are less common when it is used appropriately. The American Migraine Foundation notes that magnesium is often chosen as a preventive strategy, either alone or alongside other preventive treatments because of its safety profile. Now ask the practical question. How much evidence is there? The evidence is not perfect, and that honesty matters. A 2026 systematic review examined 6 randomized controlled trials of oral magnesium for migraine prevention, with study durations generally around 3 to 6 months and doses commonly in the range of about 380 to 600 milligrams per day, depending on the formulation. Some trials favored magnesium over placebo for reducing attack frequency, while others did not. Some comparator studies found magnesium helpful, but not always as strong as standard medications such as valproate. In other words, magnesium is not magic. It is a tool with a biologically plausible mechanism and clinical trial support, but its effect depends on the person, the form, the dose, the duration, and the migraine pattern. So give this command: measure the pattern before judging the treatment. If someone takes magnesium for 4 days and says it did nothing, that may be too soon. Preventive migraine strategies are judged over weeks, often 8 to 12 weeks or more. Keep a headache diary. Write down headache days, severity, triggers, menstrual timing, sleep, caffeine, medication use, nausea, light sensitivity, aura, and rescue medication use. Why? Because the goal is not only did the headache disappear, the sharper question is, did attacks become less frequent, shorter, less intense, or easier to treat? Now let us discuss the body's hidden magnesium problem. Ask, why can a normal blood magnesium test be misleading? Because blood serum contains only a small fraction of total body magnesium. The NIH notes that less than 1% of total magnesium is in serum, with much of it stored in bone and soft tissues, and serum magnesium does not always reflect total body magnesium or tissue levels. The American Migraine Foundation also explains that simple blood magnesium levels do not accurately measure magnesium levels in the brain. So a person may be told, your magnesium is normal, while the nervous system may still not be telling the whole story through that single lab value. This is where the story becomes clinically elegant. Magnesium may help even when a standard blood test does not scream deficiency. Why? Because migraine may involve local brain excitability, intracellular magnesium handling, absorption differences, genetic tendencies, or increased urinary loss. People with diabetes, gastrointestinal disease, alcohol dependence, older age, or certain medications such as diuretics and proton pump inhibitors may be more prone to magnesium inadequacy. So do not look only at a lab number. Look at the person. Look at diet. Look at medications. Look at gut health. Look at kidney function. Now ask, how should magnesium be used intelligently? First, separate food from supplements. Food magnesium is generally safe in healthy people because the kidneys eliminate excess amounts. Encourage magnesium-containing foods, pumpkin seeds, almonds, spinach, black beans, edamame, whole grains, yogurt, and other fiber-rich plant foods. Food builds the foundation. It also brings potassium, fiber, polyphenols, and other nutrients that support vascular and metabolic health. Do that first whenever possible. Second, if using a supplement, do not be casual. Read the label for elemental magnesium, not just the total compound weight. Magnesium oxide, citrate, glycinate, and other forms differ in absorption and gastrointestinal tolerance. Some people tolerate glycinate better. Citrate may be better absorbed for some but can loosen stools. Oxide is commonly studied and inexpensive but may cause diarrhea in some individuals. Start with medical guidance, especially if the intended dose approaches migraine prevention ranges. The NIH notes that the adult upper limit for supplemental magnesium is 350 milligrams per day, while migraine studies and clinical recommendations sometimes use higher amounts, which is exactly why supervision matters. Third, ask, who should be careful? Anyone with kidney disease must be especially cautious because impaired kidney function raises the risk of magnesium toxicity. Also check medications. Magnesium can interfere with absorption of tetracycline and quinolone antibiotics, and it can reduce absorption of oral bisphosphonates used for osteoporosis. Diuretics and long-term proton pump inhibitors can also affect magnesium status. So command the audience clearly. Do not stack supplements on top of medications without checking interactions. Fourth, respect side effects. The most common practical barrier is the gut, loose stools, abdominal cramping, nausea, or diarrhea. This is not a minor detail. It is often the reason people stop. How do you handle that? Take magnesium with food if appropriate. Consider splitting the dose. Consider a different form. Reduce the amount. Stop and seek guidance if symptoms are significant. And never confuse more with better. In mineral physiology, the best dose is not the biggest dose. It is the dose the body can use without creating another issue. Now ask, what about an attack that is already happening? Oral magnesium is mainly discussed for prevention. Intravenous magnesium sulfate has been studied for acute severe migraine, particularly in emergency or clinical settings, and the American Migraine Foundation notes that IV magnesium appeared most effective in people with a history of migraine with aura, while benefits were less clear for immediate pain relief in those without aura. So do not tell people to improvise acute treatment at home. Say this instead. For prevention, discuss oral magnesium. For severe acute migraine, especially with aura or prolonged attacks, seek clinician-directed care. Now let us make it personal without becoming sentimental. Think of the person who loses 2 days every month to a menstrual migraine. Think of the student who sees shimmering lights before the pain. Think of the parent who keeps working in a dark room because life does not pause for migraine. For that person, a preventive strategy that lowers attack frequency even modestly can change the rhythm of life. Not because it cures everything, but because one fewer attack can mean one saved workday, one normal dinner, one uninterrupted night of sleep. Ask one more why. Why is magnesium worth discussing before more aggressive steps for some patients? Because it sits at the intersection of nutrition, neurobiology, affordability, and prevention. It can be added to a broader plan: regular sleep, hydration, protein-balanced meals, trigger management, appropriate acute medication use, exercise, stress regulation, and evidence-based prescription prevention when needed. Do not isolate magnesium as a miracle. Place it inside a migraine plan. That is how it becomes useful. So here is the final message. Magnesium can be beneficial for headache most convincingly when the headache is migraine, especially migraine with aura or menstrually related migraine. It may work by calming neuronal excitability, modulating NMDA receptors, influencing glutamate activity, supporting energy metabolism, and raising the threshold for the brain events that help generate migraine. The literature is supportive but not flawless, so use it with precision. Track symptoms. Choose the form thoughtfully. Respect dosing. Watch the gut. Check kidney function and medication interactions. Speak with a healthcare professional, especially if headaches are frequent, changing, severe, or disabling. Now give the audience one final command. Do not chase relief blindly. Build prevention intelligently. Ask, why is my brain vulnerable? Ask, how can I raise the threshold? Ask, what pattern am I seeing? When those questions guide the plan, magnesium becomes more than a supplement. It becomes a strategic part of headache care. Take care of yourselves, take care of each other, and keep this conversation within the circle of people you love. I'll see you in the next topic, where we keep learning together like a family that gets healthier one conversation at a time.